How do I start talking about this? I guess the word is cant, not the apostrophe T, but a cant in the smile. Let me jump in and show you exactly what I mean. Here's what a cant in the smile is. It's when a smile slopes from left to right, because a smile in real proportions need to be parallel to your eyes and your lips so that the teeth fall into the right plane. Not having teeth that are sloped in one direction and no longer being parallel to those two very important, critically important, aesthetically pleasing visuals. So a cant is something that can be corrected with porcelain veneers by a few different things. The most important thing is being able to visualize it and understand, and educating to your patients, because a lot of people come and say, I don't like my smile, but they have no idea why. So a very common thing is having a cant. This isn't like an uncommon thing. This is super common. And what you're seeing here is in that same slope that goes down, one side is higher and one side is lower. So what needs to happen when we're correcting for these specific changes is exactly using veneers to pretend like you're actually moving the teeth. So the veneers here are going to go lower, and then these teeth are going to move higher by having to reshape the edges a little bit more so that the veneer can be a little bit higher. And the beautiful thing that I'm going to do is show you some interesting parts of the veneer process. In addition, you're going to see there's some decay in this area, and that's one of the reasons and indications for when you want to open up a contact and finish the veneer on the back side of the tooth, which I'll also show you in this case right now. So this is a really interesting photo. You're usually used to my side-by-sides of temporary porcelain veneers, but I fooled you. This is a preparation for a porcelain veneer case. The one side is original and the other side is prepped, and the reason I like to do this is to be able to visualize for myself and for educational purposes what that means and how little needs to be removed in order to be accepting of a porcelain veneer. The other thing I want you to notice is what happens when we prep into a tooth that is already dark, right? There's elements of these teeth that are getting darker, and this is what I meant also by having to change the position of the edges so that the veneer can now kind of wrap around this way, and the opposite side is going to come down, so that the goal is, so as she smiles, there's a nice evenness, even though in her case the gums are disproportionate. But what's interesting is every single person is different, and in this case in particular, her gums are covered by her lips, so we're really just focusing on the teeth themselves. This is what the veneers look like on the models. You should see now that the smile is corrected, we have beautiful translucency elements in this tooth, beautiful reflective properties, and of course the ceramist knowing exactly where my margin is so that we have a flush transition between the natural tooth and porcelain veneers. And on the back you can see how little of the tooth needs to be reshaped and how much of her natural tooth stays intact. And that area that I said she had decay, why we had to open through the contact, that's where the porcelain finishes. So when you have decay on the front tooth, you break through the contact and you finish the margin of the veneer on the back side. So again, here you're seeing how little tooth needs to be removed and how much can be maintained. Oh, this is the photo you're used to. Half temporaries to half permanents. You can see it's an absolutely perfect match between my temporaries and my permanents. Obviously, the one big changing factor, as I always say, is the temporaries are a porous material and the permanents will never change color for as long as you have these veneers. So these are a perfect match for temporaries to permanents, and what you're seeing is that now I'm fully convinced and confident that now I'm at this point able to put the veneers in, and this is what her smile looks like. Notice how we corrected for that cant right here. The teeth are shaped properly, There's even distribution of left and right, and also you can see how the edges of the teeth are actually corrected for. So that's where we started to where we are now. And the other side is you can view from the side profile view as well how this is now how the teeth kind of follow along the architecture of the lips, and it doesn't look like it's canted from left to right. The other thing that I want you to notice is these are natural teeth. These are natural non-porcelain veneers, and these are the top are porcelain veneers. So that's how it was originally. You can see how this tooth is much higher, this one is angled off, and then sort of misshaped teeth that are corrected for beautifully with veneers. And again, you can see in this smile how natural and youthful this smile is for an undetectable, beautiful, life-lasting porcelain veneers.